Welcome back. In our latest Changemakers segment, May is Mental Health Awareness Month, so we're spotlighting a local nonprofit that's dedicated to providing mental health services and care in communities with limited access to those resources.
So important. The Chicago Foundation for Mental Health consists of a team of clinical psychologists providing care on the city's south and west sides. And joining us now are Dr. Katie Guada over here in the gray, the founder and lead psychologist, and Dr. Stacy Stewart, clinical psychologist and staff member. Thank you guys both for joining us, especially on this holiday morning. We really appreciate it. So Dr. Guada, what inspired you to start this back in 2021? Why was it so important to you?
You know, I've always loved working in the community. Growing up, I was really close to my mom and her mother, my Nana. And Jesus, the message of Jesus was really big, you know, so I always wanted to find a way to give back. That message of servitude has always been very important to me. So I opened my for-profit business in Schaumburg, Illinois, Guada Psych, and once I was on my feet financially, I invested money from that business into opening the foundation, because ultimately my goal was to be able to serve the community in any way I can, especially Chicago, the greatest city with the greatest people.
Communities who are underserved,
Yes,
who don't have
absolutely.
easy access to mental health resources.
That is what we are all about, accessible and affordable mental health resources.
And what are some of those resources specifically that you provide?
We provide individual therapy. We work in schools. We're always looking for new schools that need services, under-resourced. In those schools, we offer individual therapy services. We also offer social emotional learning. And then we have an outpatient location on 79th Street.
Okay.
And we're always available virtually as well.
So Dr. Stewart, talking about partnerships with schools and the work done in schools, and I know you're looking to expand and also hopefully work with CPS. What type of work specifically do you do in the classrooms, and do you know specifically students who might particularly need extra counseling or help?
Yes, yes. So one thing that I will say is that I think that these sorts of services are needed in all schools, right? I think that all kids should have access to this. You have a lot of kids, especially on the south and west sides of the city, who at any point in time have been impacted by gun violence, right? When we think about also these under-resourced and marginalized communities, right? Poverty is a risk factor, and so there are all sorts of, you know, family struggles, economic struggles that these kids are privy to, and need a space and an outlet to really kind of debrief about those things. And so that is a lot of what our services are all about, doing a lot of pull-out services for kids during the school day, doing some individual therapy, also teaching SEL in the classroom. I think now that it's becoming more popular and people are much more open to it, but we need to teach our kids how to regulate themselves emotionally. That's really important, how to express their emotions. What are some words for what they are feeling? And we also do some great work with parents. We have an awesome group for mothers who have lost their children to gun violence, and so that's another group that we also run on the south side as well. Awesome grief group for people to just kind of come in and express themselves. And get some resources on like exactly how do you deal with some of these things.
And that's so very important, because these young people are exposed to some really traumatic things at such a young age.
Yes.
And it becomes almost like, unfortunately, a badge of honor to deal with it and show you're tough and internalize these things. And they could really have some PTSD and things of that nature. How effective have you seen the treatment be since you've been in these communities?
Yes, you know, I know that Dr. Guada was recently at a graduation at one of our schools, and some of the kiddos were kind of bringing up how helpful it has been to have some of these services.
That's fantastic.
We're starting to see our kids be a little bit more regulated in the classroom. We're starting to see them have words for exactly what they're feeling, how they're feeling, letting us know when they need a timeout, when they need to step away. And so, you know, that sort of qualitative data is so meaningful. And
that it's okay to validate,
Yeah.
like, you know, I don't need to be the tough person right there.
Right, exactly. And another question for you, Dr. Guada, and that is, how would you like to expand, and potentially how can people access services outside of the schools?
Absolutely. You know, it's very there's such a huge need for mental health services. So any way we can reach communities, we are finding that the best way to reach communities is in the families, is inside of the schools. But as far as how we'd like to expand, we're available virtually. We do need funding in order to get more brick and mortar locations. One thing about working in the schools is you are able to cut through the huge stigma that exists in working in the Black and brown communities, under-resourced populations. We're able to really get in to see people who need services and reach their families. So we see, as far as expanding, that reaching the most people and making the biggest change, we feel that that's a really good opportunity for us. Brick and mortar locations in the community.
Sort of a one step at a time.
It's one step at a time.
Right, yeah.
Engaging the community. You know, we need people to come. We need people to come to their appointments, follow up, be consistent, and that's definitely a challenge we face in the community.
Being bilingual helps, though. That's for sure, to be able to reach. I wish we had more time, because this is very, very important information, and congratulations on what you're doing, and continued success to Dr. Guada, Dr. Stewart. And again, this is a look at their website. You can learn much more information about the Chicago Foundation for Mental Health by heading to tcfmh.org. Right now, let's send it to David Yeomans with a check of our